Hi, this is For the Better, a podcast for healthcare marketing professionals navigating change and innovation. It's produced by Reason One, a digital agency dedicated to building a brighter digital future for the healthcare industry. I'm your host, Ben Cash.
Hello, I'm Lauren Miners. I am Director of Partnerships and Marketing, and welcome to this episode of For the Better. I am thrilled today to be sitting down with Amy Comeau. Amy is an award winning author, sought after speaker, and consultant specializing in marketing, healthcare, and leadership. And drawing on her extensive experience, most recently as VP of Marketing for Emory Healthcare, Amy guides organizations and leaders through complex challenges. Her career spans the healing arts, leveraging the art and science of music and medicine across healthcare, nonprofit, higher education, and the performing arts industries, including leadership roles at the Atlanta Opera, Georgia State University's Rialto Center for the Performing Arts, and Emory School of Nursing. And she is also the winner of the 2024 Goody Business Book Award for Leadership Inspiration for her debut book, Every Storm Runs Out of Rain, Leading a Healthcare Marketing Team Through a Global Pandemic, which I have a dog-eared copy of right here.
Oh, wow.
And she offers candid insights and leadership lessons from navigating oneself and one's team through crisis, challenge, change, or chaos. So welcome, Amy.
Oh, Lauren, thank you so much for having me today. I'm really excited to talk with you.
Well, wonderful. Well, let's get into it. I sat down and read your book in an afternoon, sitting on the beach next to my husband. And I think every other 10 minutes or so, I was like, "Ugh, I need to do this. Oh, I wish I had had a leader that has done this." And so I just want to first start with thank you so much for sharing everything that you and your team experienced over this wild 24 months that we all went through in healthcare. But what stuck out to me personally as a marketer was that some of the actions that you took in general as a marketing leader made me think, oh, this is the kind of leader I would have wanted at specific stages in my career. And so I kind of want to focus on those aspects rather than the pandemic piece of it, but we'll get into some of those things. So I first want to know, like, what inspired you to implement these Friday emails? How did that kind of come up to you?
So this is it's actually a funny story. So I had been in my role for 10 years as head of marketing at Emory Healthcare. And I would say maybe about halfway through. So I was at a leadership retreat. So I'd been in my role for several years, but I was at a leadership retreat, and I think it was one of our nursing leaders. We were talking about employee engagement and gratitude and all of those things. And she had shared a story about how she had a boss in a previous job that would send Friday emails to the team, like either recognizing somebody or, that was her leader's way of expressing gratitude. And I thought, that's so cool. I would love to do that. But if I just started the Friday emails out of the blue to my team, they'd be like, she's nuts. What is she doing? So I never did. So I didn't implement it because I couldn't figure out how to do it in a way that actually felt authentic to me and didn't have my team going, why is she all of a sudden starting these Friday emails? So that's where the inspiration for it came. And then when that first week of the pandemic, I wasn't even thinking about writing Friday emails to my team, but it really was Cheryl, another leader on my team, who said, you should really send that full page ad out to our entire team, so that they know that it's happening, so that you tell them and they see it before it runs in the paper. And I was like, oh, that's such a good idea, because when you're a leader, and you're working so hard on creative, sometimes you forget that the entire team's not working on it. There's just a handful of people that are working on it, and you forget that the team doesn't necessarily know that that's happening. So I was happy for her to make that suggestion. And then I think in my mind, I was like, you know what? This is a great opportunity for me to figure out how to put that Friday email concept into place. And I honestly thought it was just going to be to get us through 8 weeks of shelter in place. Like, this is going to be my way of of, you know, um, really getting the team to gel, staying engaged with the team in this now immediate virtual space that we were going into. And I found that over time, I loved it so much that I kept doing it. It was writing therapy for me, it was reading therapy for my team. And so I kept doing it until my very last day at Emory. In fact, the last email I sent at Emory was my Friday email to my team. And I hit send and then, closed everything up. And that was the last thing I sent to them.
Oh, wow. That's that is so cool that you had like, yes, this germ of an idea, and sometimes it just takes the other, the other impetus to make it make sense. Because you're right. Yeah, like if my boss just started sending Friday emails out of nowhere, I'd be like, what are we doing here?
Yeah. Like,
These are
why is she crazy? What happened?
right.
Yeah.
What's going on? Um,
Yes.
and what struck me about the emails, especially as like you mentioned, oh, this is just for 8 weeks, whatever. And then life started to happen.
Hmm.
And you really showed your vulnerability. You brought in a ton of levity. We talked before we joined about the Sophia Chia head, and we saw pictures of you in witch costumes and like all of this kind of stuff. I feel like I got to know you on a personal level, but I can imagine that would have been even more powerful for your team. So was that something that just kind of continued to bubble up naturally for you, or was that already kind of your rapport with your team? Can you speak to that a little bit?
Yeah, I mean, I think that I am. I've always been sort of that person. I think lead with humor. I mean, humor's always been part of how I just operate on, at home or in the workplace. And I always want to make sure that I'm connecting with my team because I feel like, you spend more time together. You spend more time often with your work family than you do with your own family, your actual family. And so I wanted them to know that I am a human just like them, right? We all have different challenges, we all have different life stories. And I didn't want to be that intimidating, stereotypical gregarious CMO. It's not who I am. I mean, that's not my personality. I'm actually much more of an introvert. People don't believe it when I do stuff like this, but I really am. And so I wanted to be accessible to my team. I wanted them to feel like they can be themselves, of course, and still, do be productive and do the work and do all the strategy and everything that we need, that we were hired and charged to do. But yeah, it just, I would say from the emails perspective, it happened organically. There were probably some times like, I don't know if I should do this or not, but sometimes I would do it just to see if people are actually reading, right? Like, you write these Friday emails, and I would write emails to my team, and in the early days, people would respond, and then weeks would go by, and I'm like, should I really keep doing these? Is anybody paying attention? So sometimes I would just throw in a little bit of levity, and then I was trying to figure out what would engage the team. And so it was almost like an experiment, like a test and learn experiment to see what worked and what didn't. And then over time, I started realizing I have always forever liked to teach through analogy. And so, and or metaphor. And so you see that as the emails go on, I am I'm looking at something that happened in my own life to help teach the team or teach somebody, make an analogy to something that was going on now, and how either you overcame it or different things. And so I think that's also where some of that came about was, hey, I had this experience when I was 12, and it speaks to me today. And so now let's think about how we can apply that learning to what we're tackling right now in the workplace.
Yeah, that's so huge to be able to remove that remove that one layer of filter from yourself, because it's hard, right? You're like, am I sharing too much? Am I making it about me? Or
Hmm.
is it really about them? And I wanted to ask too about their response, but it sounds like it was like when you hit certain buttons, that's when you had your team respond and engage. That's interesting.
Well, it is interesting because I would have different people, like not everybody would respond to every email. And in the beginning, people were just thankful for, they would say, thank you for putting into words what I've been thinking, right? On some of the more heavier stuff, things that we were going through, or the unexpected. But like when I shared the picture of me dressed as Maleficent for Halloween, and I joked about, walking around the my neighborhood just in full costume. I didn't go in full costume, but I had somebody on my team who had didn't ever really respond to my emails, and she's like, "Oh my God, I hope that you will go and walk your neighborhood in full costume and send us pictures. I want to see your neighbor's reaction." So you just never know like what story is going to resonate with what person. And I think that's what I loved so much about it, was it was an opportunity for me to share myself with my team, but then through my being vulnerable, they would then be vulnerable back to me on a one-on-one basis. And you never knew who it was going to be, but they would, something I wrote about would compelled them to then respond. And that made the whole process worthwhile.
Yeah. Oh, that's so meaningful. I have this one another thing that I got from your book is that you are like me and you love quotes.
Hmm.
Um that was just so heartening. So I'm like, I feel like I'm the, maybe it's cliche or something, but you can't see, but I have quotes all over my walls here in my office. And one of them is from Seth Meyers. I feel like the show gets better the closer that my on-screen persona is to who I really am. And that resonated with me in your book as well, is like you have to build those relationships, you have to be yourself.
Yeah.
Yeah.
Yeah. I love that quote. I remember, I think you posted about it on LinkedIn, and I have to say, I feel that his comment so much, because the more I started leaning into me and my personality and my leadership style, the more it paid off, right? It was like I used to think I had to be somebody else, right? I used to think that I had to really embodies sort of like that extroverted, very direct, kind of larger than life personality, because I thought that's what you needed to be a chief marketing officer. But it never really resonated. It didn't feel natural to me. And so I was like, well, let me just start leaning into me. And as I did, I realized I was leading with my authentic self, and therefore I was engaging with my team, my leadership team, and my team in a much better way. And some people, I remember comparing myself to a predecessor of mine. I'm like, well, I wonder what she would do. And somebody said, don't, don't think what would she do? What would you do? You guys are both amazing leaders, but you're amazing leaders in different ways. And it's your uniqueness that is your strength. And so, I read that quote. I really thought about that a lot. And really, really figured out how to lean into myself and to make those connections.
Thank you. Thank you for saying that about this perceived notion of what a CMO is supposed to, because I have that same thing in my head. It's like this shape, and do I fit into that?
Mm-mm.
Yeah. Does it matter?
No.
Like, are we trying to, in marketing, I think that it's constant experimentation. We're
Yes.
up against stuff that we cannot control all the time, but yet we have to maintain some sort of like, this is what CMO looks like. This is what director looks like. And maybe we could relax those things a little bit more to be more effective.
Yeah. Yeah, I was talking to somebody about this, because I'm like, it's not like there still is, you still have your work persona, and you still have your friend persona, and you have your home persona, right? And they're all connected but through your personality. So like when I'm in the workplace, I'm me, but there's also, you have a certain persona you bring, and a not a veneer, but to when you're sitting in the C-suite, when you're sitting in a boardroom. So you do have to have that executive acumen, that business presence, right? It's not just like walking in and just being, super crazy all the time. So you do have that, but there's a way to be professional and be a leader and still be be you, right? Let that come through. And it's almost like, how do you refine, it's like refining the parts of you that make you you, and then presenting them into, it is like, it's knowing your audience. Like, how do you present CMO Amy at the C-suite? How do you present CMO Amy to your team? How do you present CMO Amy when I'm in, at a conference or networking with other people? So it is, I mean, there are different packaging, so to speak, but it all, at the end of the day, is still, the core of it should be around you and your beliefs and who you are.
Being human. Yeah. Yeah, and I can imagine, I'm gonna kind of switch gears a little bit, but Before we started recording, you and I were chatting about burnout, and I've been through burnout a couple of times in my career, and usually you don't recognize it until it's too late.
Yep.
Um, but in those instances, this personal experience, but in those instances, I felt like it wasn't just the work that I was doing that was contributing to burnout, but it was the work plus some sort of false persona that I also had to maintain
Mm-hmm.
during doing the work. And so it's like it's both and. So I would feel like, perhaps having those kind of real conversations and real relationships would go a long way, right? And maybe combating or curtailing burnout to some degree. What can you speak to on that?
Yeah, I mean, burnout is interesting, right? So I was burnt out. And when I gave a talk on this earlier this year to a healthcare marketing and communicators group in Kentucky, and you don't realize you're burnt out until you actually start to heal from it, like you get yourself out of it. And so I think I was probably burnout in burnout for about 18 months, if not 2 years.
Oof.
I didn't realize it. It wasn't until, like I said, I stopped, I left my role at Emory and I found I was sleeping, 8, 10 hours, no, 10, more like 10 to 12 hours a day for weeks on end because my body just needed to heal. And as I was healing, in my mind, I was healing, I was looking back and I was like, oh, yeah, that was burnout. I was burnt out. And so it becomes, um, for me, and the definition that I've read, the sort of a clinical definition of burnout is when the demands of the job outstrip your resources to do it. So it's not just a personal issue; it's that you can't you just can't keep up, right? And there's not the prioritization that maybe that needs to happen, and you don't have the tools to do what you need to do. And so this is where they look at burnout in clinicians, but then the same happens in burnout in non-clinicians. And so I found myself to a point where even with my team, they're like, we need to do this, or why aren't we doing that? And you just kind of like, it's almost like you get paralyzed, right? I don't wanna say paralyzed, but you can't respond to it, or you're just so exhausted, you're just like, yep, you're right, but this is what we've gotta do." And I think from me, from a burnout perspective, particularly, we were talking about this from a healthcare, uh, perspective, non-clinicians experience it at the same, if not higher rates than clinicians. And I think so I think burnout in healthcare is a issue across the board. But I find that it compounds on non-clinicians when the focus is so much on the clinical burnout at the expense of non-clinical burnout, right? So that's often the teams that are doing all of the burnout interventions are those non-clinical teams, and they often are the ones that are understaffed or under-resourced. And then particularly now in this economy, we're seeing so many cuts to non-patient facing roles, which then further shrinks those teams. And I kind of call it the whack-a-mole effect, where it's like you're already struggling, and now you're just getting hammered deeper and deeper into the whack-a-mole machine because you can't address your own burnout while you're trying to meet the demands of the job, and then also work to help implement programs for other people's burnout except your own.
Yeah, it's the whole thing of, no, you really do have to put your mask on first before you
Yeah,
help anybody else, because
totally.
as the whole thing is going to collapse, and you kind of
Hmm.
touch on that a little
Hmm.
bit in your book, and I just want to highlight something that stood out to me, and why my sense after reading it was, wow, I really could have used this type of leadership in my career, is that you consistently were reminding your team the exact impact that they were having. Because I would imagine that there is some sort of disconnect, right? Like you're not, they were feeling like, well, I'm not, am I a frontline worker? Am I not? Like, how are we defining that? I need to get my vaccine, all of this stuff. And it's like, yes, you are a frontline worker.
Hmm.
This is happening because of the efforts that you're putting out. And I just want to highlight that as like, That's leadership. It's so leadership in action is showing people exactly what their value is.
Yeah, I mean, it was really important, and I don't, I want to say I was deliberate about it, but it was really like trying to find because you would see the team like we all struggled, right? Particularly different through the different phases of the pandemic, but it was actually that work that we did during the pandemic that even hammered home for me that we were truly that we truly were patient facing roles that we, my team is, they're sending emails to patients, they're getting responses back from patients, they're, interacting on social media, responding to, positive comments, responding to negative comments, like all of those things. So we are patient facing roles. I mean, just think about the website alone. The website for any healthcare organization is the single largest access point, right? You
Hmm.
have more people that come to your website on an annual basis than that come in through patient appointments or inpatient stays. And so just recognizing that and then sharing with the team because sometimes they get lost in the work, right? Or they're like, why are we doing this? I don't feel like I'm part of the organization. Or they're part of the organization, but they don't feel connected to the work. And so for me, it was very important to always connect back to them how the work they were doing was actually improving lives and providing hope for our patients, which was our true north statement when I was at Emory. And I had people say, thank you. That is reminding me it's not just about money. It's not just about
Hmm.
finances. It's not about driving volumes. I mean, yes, all of that's important. But the reason that healthcare exists at the end of the day is to make people better. And so, what better way to connect with that than pointing out to your team how the work that they're doing is contributing to improving someone's life?
Yeah. Yeah. Um, Thank you for that. That's just so important to highlight those things. I don't think many marketing leaders do that
Yeah.
across industry, and to me, just speaking abstractly, I feel like that would go a long way in combating that sort of burnout where you are in that stage of, well, does any of this or even matter? What am I doing?
Right.
Am I having a fight about fonts? Like, or
Right.
whatever.
Right. Well, I mean, this is a real life example that happened when I was at Emory. So we were very involved with the population health efforts at Emory and our clinically integrated network and making sure that people were, there's the big 15 of areas that measures that we needed to meet, and these are part of our shared savings agreements, right, with the payers. And so yeah, there is a financial benefit to those, but there's also the reason all of those things exist is to, again, it's improve people's lives, and so you focus on the quality. And the team was having a hard time understanding, like, why why does she keep making us focus on this population health and the and reduction of um, or increasing the adherence to some of these screenings. And I was like, well, so I stopped. I took a moment where we did a full afternoon retreat. I said, all right, let me explain actually what the economics are of these agreements, but then also the patient benefits. So I shared with them, I just educated them, like, here's what a shared saving agreement is. And here's, there's millions of dollars that are of revenue that are on the line here, which is great for us organizationally. But then if we do all these things, you're going to improve the quality of people's lives. That's why these quality measures are there. And so it was through taking the time to explain that to them so they knew both the financial, but not just the financial, but then the quality reasons for it. They got super engaged. And it was an opportunity to use our new CRM system and marketing automation with a part of the team, with a part of the organization that was willing to let us figure out how to do this for them at a low cost, with a low cost opportunity. Whereas, other parts of the organization, they're fixated on the big ticket items like television or billboards or all of that. So I said, let's take their eagerness for us to present something new to them and experiment, let's really build this out. And then here's why it's important. And once they understood that, once they understood the financial and the quality benefit, and then the opportunity to leverage these tools the way they've always wanted to leverage them, they were so excited. And I think I shared in the an example in the book that we were able to um, double the impact of our quality, our population health efforts through by adding on this layer of marketing automation and CRM and lead and nurturing of those individuals. And then by and then also be able to demonstrate, okay, because of this, we had so many more women get screened for breast cancer, which means that you've saved lives. Because if you do the math, right? If you do the math of how many screenings it takes and what the percentages of those screenings that turn into cancers, I'm like, you've saved your work has actually saved lives. We don't know which ones, but we know that it's had an impact. And so that I think was really engaging and meaningful for the team to have that entire, sort of 360 experience.
Yeah, absolutely. And I do remember that example from the book. That was definitely one that I remember being like, Trip, listen to this. And going through all the stats, because it amazed me too, that just the ripple effect and all of the percentages and the estimations and stuff like that. It's like, wow, just just implementing a true CRM and automation, which is like just one of those marketing things, can have such an impact. And what I the other thing I thought was cool about that is like sometimes it takes those pilot projects that are just doing one very
Mhm.
specific, low risk type thing to show major impact that can then, okay, we've done it once, now we can implement it in
Yep.
these other ways that make sense for the broader organization. So um love that your mindset of being able to go in, find a niche, find a thing that we can fix. This could be better,
Mhm.
and demonstrate its impact.
Yeah. I mean, and we would call it the Me Too effect. Like you want to convince other people who are used to other things. And so sometimes they're the harder ones to convince. So you find, it's like with the path of least resistance. You find somebody who's willing to, go on this journey with you, and to your point, you pilot it, and then you have tremendous success. Then everybody's like, oh wait, I want what they're having. Oh no, I want what they're having. And then it grows, right? Whereas if you're trying to convert your most vocal critic, that's going to be a lot more energy, and it's going to be a lot harder, and there's going to be a lot more risk involved there than if you can prove do your proof of concept with somebody who's willing to go on the journey with you.
Yeah, yeah, exactly, and it's more fun.
Hmm.
I think I'm a mess around and see what happens kind of gal. So yeah, I just love that philosophy of like, let's just play with it. Let's just see what happens, and we're gonna learn some stuff. And you're right. Like the detractors, they need the proof
Right.
first.
Hmm.
Yeah, yeah. Let's see. I want to just talk about you for a little bit. You've been talking a lot. You've been on the circuit. Where can we see Amy for the rest of 2024 or 2025? What year is it?
I know, right? I forget myself too. Yeah, so as I'm, navigating this pivot into the next phase of my career, I'm really enjoying speaking to teams and actually doing speaking engagements. So I have done, as I mentioned, I've done several talks already for like healthcare marketing and communicators groups. I've talked to teams, so I'm getting ready to. I've got several speaking engagements lined up for the fall, including the PRSA Health Academy in October, um, and hopefully Chip Rooms in also it's November, and I got something else going on in November. I've got several irons in the fire, but I'm really looking at doing speaking engagements. I've done some on the topic of burnout, so a much more curated conversation and talk that goes into the science behind burnout, and what the signs are and what you and your teams, like what you can do for yourself, what you can do for your team, and ideally what you can do for your organization. And then I more recently spoke to a business community here in Atlanta around leading with authenticity. So kind of just what we were talking about, and that Seth Meyers quote. I don't think I referenced it, but it certainly inspired me in my conversation with them. So that's one avenue I've been doing, is just kind of doing the speaking circuit, and engaging with different, whether it's a workshop with the team, or keynote for a conference, or just any other sort of like business organization that is looking for somebody fun to talk with them for about an hour.
Somebody fun to talk with them about a very unfun topic.
Yeah,
Which is what you need. You need the levity, right? Because like everybody experiences it.
yeah,
So
yeah.
that's awesome. And I can't wait to see you out on the road. Once again, the book is Every Storm Runs Out of Rain. Where do you prefer folks purchase this? Is this an Amazon, or do you have a
Yeah, so Amazon is, if you're gonna just get a single copy, Amazon is the best place to pick it up. My website for the book is everystormbook.com. So it has a list on there of all of the different places you can order the book. If somebody's interested in like getting bulk orders for their team, or something like that, they can message me or my publisher through that website, or I'm on LinkedIn. So yeah, but I'll have to tell you, one of my newest release that's out, and this is a perfect marriage of my arts and healthcare worlds, is that I actually got to voice my own. I voiced my book. So the audiobook version of my book is out. I spent about a week and a half in February actually voicing it, which was so much fun. And now it's out on like 30 different platforms. So it's out on Audible, Apple Books, Spotify. So anywhere you consume your audiobook, it's there, if you're an audiobook consumer versus a hard copy reader.
that sounds so fun. And with your background, I bet it was like just kind of a dream come true to be in
Totally.
studio and doing your own, but that's so freaking cool.
Yeah.
So
Yeah.
cool. Well, thank you so much for your time today, Amy. I appreciate you hanging out with me, talking about your book, talking about Sophia the Chia, um, and all of the other things, and just generally being a, a well-respected leader in marketing, in all disciplines. So thank you for everything that you put into this book, your heart, and your insights.
Oh, thank you so much for having me. I always love talking about it, and it's been a pleasure.
Wonderful. Well, we'll see you soon.
Sounds great.